We're going to be diving into the world of psychiatric mental health nurse practitioners. These are professionals who make a difference in addressing Michigan's mental health needs. So please join me in welcoming Dr. Deanna Dubé, who will be sharing why this career is so rewarding, how they diagnose, treat, and prescribe for mental health conditions, and the many areas in which they practice. Get ready to learn about how impactful this career is in helping to close the mental health gap.
Hi, everybody. I'm very excited to be here. I think this is always a great segue into trying to figure out what you want to do with your career path. And I was very excited to be able to present this opportunity. So I'm going to talk today about mental health nurse practitioners. Hold on, I'm going to go up here a little bit. Sorry, got a little bit. So again, how psychiatric mental health nurse practitioners are impacting patient practice in Michigan. And so just a little bit about me. So I have over 20 years of nursing experience, and I've been a registered nurse. Well, I've been a licensed practical nurse since I got that certificate in 2003, my registered nurse in 2004. I went back to school for my bachelor's degree and completed that in 2011. In 2013, I completed a master's degree in nursing for nursing education. And in 2019, I completed my doctoral degree and got my psychiatric mental health nurse practitioner certification. And so I've worked in a lot of different areas. As you can see, I've worked in OB and peds, school nursing, which is kind of where I ended up coming over to the mental health side. I was a sexual assault nurse examiner. I'm currently an assistant professor. I'm had hospital and academic leadership, inpatient psychiatry. I also work in that right now. I've worked in crisis residential, outpatient therapy, or outpatient mental health services and telehealth, outpatient therapy, and I've been a subject matter expert creating a psychiatric mental health nurse practitioner program for Davenport University. So right now I work, again, as an assistant professor for Davenport University in their Master's of Science in Nursing program, teaching in their psychiatric mental health nurse practitioner program, their family nurse practitioner program, and their nurse educator tracks. I am a psych nurse practitioner at my Michigan Health in Midland in their inpatient behavioral health unit. And then I work at Serenity Bay Health in Auburn in outpatient practice, delivering psychiatric care and therapy and medication management to those in the community. So this has been a wonderful opportunity for me. And when I just started nursing school, I fell in love with it. And there was nothing more that I wanted to do than care for patients. So when we look at Michigan and the mental health, crisis, essentially, mental health conditions are among the most common and untreated health challenges in the United States. And Michigan is facing a mental health crisis. And the numbers really kind of give you an idea of how this works. So we have 1.78 million adults with a mental health condition in Michigan. So that's about approximately 8 times the entire population of Grand Rapids. We have 39.9% of patients with symptoms of anxiety or depression. So nearly 4 in 10 Michigan adults reported symptoms of anxiety or depression. We have over 1 in 4 adults who need counseling or therapy that were unable to access it. So that's really a big piece, as we do have a shortage. Over 355,000 Michigan adults were living with a serious mental illness, and that is more than just depression or anxiety. It's typically something that's debilitating, such as schizophrenia or bipolar disorder. And then Michiganders ages 12 to 17 also are struggling, and over 119,000 with depression. And then finally, over 4.2 million Michiganders live in a community without enough mental health professionals. So one of the things I wanted to do was kind of give you a quick overview of mental health professionals, right? So who does what? So there are multiple people that you'll see working in the mental health field. So I figured it would be best to kind of tell you what they do, what kind of education they need, where they can work, and the salary, right? I mean, if we're looking at your potential career, we always want to know, what am I going to make? So when we look at psychiatrists, they will diagnose and treat mental illnesses, prescribe medications. They can also provide therapy. They typically need a medical degree plus residency, so 8 to 12 years of schooling for them. They can work in hospitals, private practice clinics, and the average salary in Michigan is in that $200,000 to $300,000 range. A psychiatric mental health nurse practitioner can evaluate, diagnose, treat, and prescribe, as well as provide therapy. So you need a bachelor's degree plus a master's or doctoral degree to become a certified mental health nurse practitioner. And again, we can kind of work in all sorts of different areas, clinicals or clinics, hospitals, outpatient services, schools, telehealth, and so on. And we're looking at $110,000 to $150,000 a year as the average salary in Michigan. And as you can kind of see, and this, I'll have this available for you if you want this moving forward. But since I have a short amount of time, I don't want to waste a lot of time here. But we have clinical psychologists, and they need a doctoral degree. Licensed counselors and social workers typically need master's degrees with plus their licensure. Mental health counselors can be bachelor's or master's. Registered nurses work in a lot of different areas as well: hospitals, inpatient units, outpatient units, community health centers, and so on. And then mental health technicians as well. So what is a psychiatric mental health nurse practitioner? Because I'm sure many of you have never heard of it. But a psychiatric mental health nurse practitioner are advanced nurse or practice nurses who provide holistic care while focusing on the mind, emotions, and behavior. So we utilize subjective and objective assessments, screening tools, diagnostic and laboratory assessments. And again, all of these to formulate mental health diagnoses and determine a plan of care to treat mental health conditions and improve a patient's quality of life. So who do PMHNPs work with? So I have a degree that is across the lifespan, is what it's called. So I treat anyone from, birth to death. So children and adolescents, adults, older adults. We treat families. We work in diverse and underserved communities. And again, we provide that holistic care across the lifespan. The whole goal is treating the whole person, not just one aspect. And so that's one of the really awesome features of being a nurse practitioner, is that our main goal really is to make sure that the patient has everything that they need, that we're not just focusing on one aspect of their health, but looking at that entire piece. So what does a PMHNP actually do? So again, there's a bunch of different things here. Again, there's the science component. We do a lot of therapeutic communication, compassion towards our patients. We practice independently. We assess, diagnose, treat, and prescribe to help patients with mental health conditions. And so I'm going to go into these a little bit more, but this is kind of an idea of what it is when I'm seeing patients that I actually do. So when we look at assessment, we look at, every care relationships begins with thorough and compassionate assessment. One of the things that we have to do is really get our patients to, gain trust in telling us how they feel, because a lot of times this is a very private thing and there's a lot of stigma attached. And so patients don't always feel comfortable talking about their symptoms. And so, we talk about mood, sleep, appetite, energy, and concentration. We talk about thoughts, including thoughts of self-harm or harming others. We talk about their life. What does it look like in their life? What was their family like? Where were they at in their education? Are they working? What are their relationship dynamics? Did they just get out of a relationship this is impacting their mental health right now? Did they just lose a job? Do they have family stressors? And so all of those things can impact a patient's mental health. We also need to look at their medical history and their previous mental health history, if there is any. We look at the medications that they're currently on, and we look at the medications they were on. And those are all things that kind of give us an idea of, what is going on with their patient. And we also even utilize, looking at substance use history, if there is one. But we also do an objective assessment, which is what I'm gathering from the patient just through things like observation. So I'm looking at a patient's body language, their eye contact, and their posture. I'm looking at their mood and their affect, and that affect is how we actually express our emotions. So like when you're really happy and you have that big smile on your face, or you're really sad and you look sad or withdrawn or tired, or you've been crying, we look at all of that as, how is this impacting our patient? Is what they're telling us actually even, matching with how they're expressing their emotions? We look at speech patterns and thought organization. We also utilize tools such as screening tools. So I don't know if you've ever been somewhere and they've asked you certain questions like, You know, in the last 2 weeks, have you felt sad? Have you felt tired? Have you had difficulty concentrating? So all of those things kind of go into us, making an accurate assessment based on what the patient's telling us and what we can observe. And then we also use clinical interviews. Again, like it's very, important that we're looking at what the patients are telling us. And then we're looking at structured or a collaboration with other providers as needed. Sometimes we need more information, and that means we have to reach out to maybe their primary care provider. Maybe we're reaching out to a therapist. Maybe we're reaching out to somebody who's worked with them before. So again, like all of these things are different ways that we can, formulate a diagnosis. So when we look at the diagnosis process, we utilize the diagnostic framework of the Diagnostic and Statistical Manual of Mental Health Disorders. And so this is, when in school, again, I'm an assistant professor and I teach this, we teach a diagnosis class. We talk about symptomology and how, we look at this manual to see okay, here's the characteristics of what this patient is presenting with. And so when we look at this book, it has more than 297 mental health conditions. So again, it really takes a lot of time to get to know your patient to be able to understand what's happening to provide an accurate diagnosis. And so again, some of those diagnoses you may have heard of before, such as major depressive disorder, generalized anxiety disorder, post-traumatic stress disorder, or attention deficit hyperactivity disorder. But again, no, there's 297 different disorders out there. And again, we formulate diagnoses with that information that's collected from the patient's current complaints, their mental health history, their social history, their medical surgical history, substance use history, screening tools, diagnostic and lab results, and that mental status exam, which is that observation piece that we utilize when we're watching or working with patients. So once we've actually, met with the patient, we've evaluated them, we've come up with a diagnosis, we start working on a treatment plan. So, and this is actually a pretty big part of our job is we are, with an accurate diagnosis, we follow different things to kind of tailor this treatment to that individual. And we always make sure that the patient is a big part of that treatment plan. So and that's again, us doing a holistic, plan of care. Does the patient agree with this type of treatment? Because they may not. We may think it's the best type of treatment for them, but if they don't, then that's truly something that we wouldn't, we don't want to go down that avenue because they're not trusting in us in this piece. And they're not going to do those things if we ask them to do them and they don't want to. So that's why it really is important that we're listening to our patients. So one of the first things we do is we start setting goals for recovery. So again, we utilize SMART goals. So they have to be specific, measurable, achievable, relevant, and time-bound. And this allows us to measure. It gives us that ability to say, you know what, this treatment is working, or we're giving a time frame, because patients always want to know when they feel better. How am I going to know I feel better? What does better look like? Is it going to take a while? So again, this is why we're very specific with those goals. So the patient understands what's happening and we're all working towards the same thing. So for example, we might look at this goal for the patient is to practice mindfulness daily. They're going to do it 10 minutes each morning. It's a simple, low barrier habit, right? It's something that can be done very quickly and easy to kind of integrate into your day. It directly targets anxiety. So this is why we're doing it. And our goal is set for 4 weeks. So we want to see that they are actually practicing this, hopefully daily, but we can always say even, 90% of the time, 5 out of 7 days, every other day, whatever is going to be, it's going to work with what the patient needs. And so again, is it something that's achievable for them? We don't want to set goals that are not achievable. If there's no way they're going to do 7 days a week, but they're willing to do 3 days a week, that's great. So those are the things that we look at. And that's important for us to understand what's happening with our patient and for them to have input into their treatment as well. Prescribing and managing medications. So as a psychiatric mental health nurse practitioner, I hold full prescriptive authority. So I can prescribe medications to patients. Now, this role kind of changes from state to state. So in the state of Michigan, I actually have to have a collaborating physician. So I typically have a physician that is available at the time I'm seeing patients. And if there's certain medications, such as controlled substances, I have to prescribe. I'm so sorry about that. I have to be able to do that under the physician. So that's one of those things that, in certain other states, nurse practitioners can, practice they can practice independently and don't need a collaborating physician. But so Michigan is one of those that requires a collaborating physician, in that, again, we're working in conjunction to provide care for the patient. So, again, when we look at this, how are medications selected? So we learn, again, that symptomology, right? And then we look at their diagnosis and we match those medications. There's standards of care. There's medications, specific medications for specific disorders. And again, these are all things that we're learning in school. Like, why would this medication work for this patient? Why would this medication work for this symptom? We utilize those evidence-based guidelines, and we make sure that we are always doing a safety profile. Has the patient been on this medication before? Do they have allergies? Would there be any interactions with medications they're currently taking with this medication that we're looking at prescribing? And what are those risk factors, right? So do we need to consider a different medication because this isn't the best choice for the patient? It's not the greatest safety profile. We also then provide patient education. So we talk to the patient about how the medication works. What does that look like for them? How does it work in the brain and the body? How long is it going to take for this medication to be effective? For example, antidepressants typically take 2 to 4 weeks for a patient to start feeling the benefit, 6 to 8 to feel the full benefit, and of a specific dose. And if we're, increasing the dose as tolerated, it might take a little bit longer for patients to feel remission of symptoms. We talk to them about the side effects of the medications, what they can potentially expect. So these are the things that we most commonly see. We look at the risk versus the benefit. Why is this medication appropriate? Does it outweigh some of the side effects they might deal with if it helps them feel better with their mood? And then we also talk about, when is it appropriate to stop the medication? When is it appropriate to call the office or go to the emergency room if they're having some type of adverse reaction? So again, these are all things that we need to provide to our patients when we're talking about medication management. We also do look at medication adjustments. So as our patients following up with this, they're telling us how they're responding. So again, we're doing that evaluation. Did you feel any benefit? Is your depression better? Is your anxiety better? Those kinds of things. So we look at the symptoms, we look at the side effects. Are they having significant side effects and this isn't tolerable? Or are they doing just fine? And you know what? They don't have the best, evaluation yet or the best response. So we're going to increase that medication. Or if they've had some significant side effects, maybe we're going to decrease it, or we're going to discontinue the medication and try something different. We might need to do lab monitoring. So there's certain medications that might require lab work. So those are things we do as well. And then we also look at shared decision-making. So again, collaborating with the physician or anybody else that we need to at the time. Psychotherapy, one of the benefits of being a Psych NP is we can actually provide therapy as well. So that has been a really fun part of my job, is not only, working on the medication side of this, but also being able to provide supportive psychotherapy or different modalities to help patients really understand their condition and reach, remission of symptoms. Because psychotherapy and medication management are the best as far as working together. We also do crisis intervention in that planning. Like if there are suicide risks or risk for self-harm or harm to others, we have to have some type of plan. And again, we also do care team meetings sometimes, so that the whole interdisciplinary team, all of the people that are working with the patient, we're all working together to make sure the patient is we're on the same page as far as treatment goes. So where do we practice? We practice in a lot of different places: hospitals, crisis residential units, partial hospitalization programs, intensive outpatient programs, substance use treatment centers, community mental health centers, VAs, specialized residential treatment facilities, correctional facilities, outpatient and private practice, schools and universities, and telehealth. So there is an array of jobs that you could, areas that you can work in this job, in this career field. So as I'll kind of come back to this if we have time, as far as a clinical day, what that looks like. But as far as how do you become a psych nurse practitioner, you start out with working towards becoming a registered nurse. So there's a couple different pathways. You can become an associate, pursue an associate's degree, but then you have to bridge that with a bachelor's degree because, again, you're going to that higher level of education. Or you can just go right into a bachelor's degree program, which is more of a 4-year. And then what you'll do is you'll get your registered nurse, license for the state that you're living in. The next is to hopefully gain some clinical experience before you decide whether or not you want to move on. But sometimes patients or students know right away, like, I'm done with this. I want to be a nurse practitioner. I don't want to be a bedside nurse. Like, this is what my goal was when I came to school. So they're ideally gaining experience while they're going to school. So once they've completed their bachelor's degree, they can go on into a master's program. So there are 2 different ways that you can look at becoming a nurse practitioner. First is you can do a master's degree with that, and you would be an MSN, and whether it's a family nurse practitioner, a psych nurse practitioner, whatever specialty you focus on. And that takes about 2 years after your bachelor's degree. And then if you decide to pursue the doctoral degree instead, that you would be looking at an additional 4 years. So when you look at this all together, right, 4 years for your bachelor's degree or a mix of your associates with a bachelor's completion. And then you're looking at another 2 to 4 your graduate degree. So you're looking at, 6 to 8 years of school. Now, I took the long road and I did a different specialty for my master's degree, and then I went for my doctoral degree. So I have 11 years of school. So not everybody does that. But again, like my aspirations changed as I continued my career path. Once you've completed this program, the doctoral program or the master's program, you can then sit for board certification. And the board certification is national. So you can either do it through ANCC or AANP. And then what you do is once you have that certificate, then with your registered nurse license, you register that advanced practice degree with the state that you're in, and they add that to your licensure. And so, and then there's continuing eds after that. But again, this is a pathway for you to consider if you want to become a psych nurse practitioner. So again, PMHNPs are a catalyst for change in Michigan. So just to kind of give you an idea, 2018 and 2019, over 500,000 patients or people in the state of Michigan needed access to mental health services and were unable to access care. And so that's why having this advanced practice role can improve the amount of provider to patient flow and give more patients access to getting services. So some of the common reasons patients aren't able to access services can include the availability of the services in their area, lack of insurance, and the cost of services sometimes. And then psych NPs are crucial in underserved and rural areas. So we bring a lot of care to communities that face significant shortages. And then as far as availability in Michigan, we look at right now, Michigan's mental health workforce shortage is critical with a ratio of 330 to 1, which means that there is one mental health provider for every 330 people in need. So the gap underscores the urgent demand for us to have this type of practice in the state. And our goal, again, is to improve holistic treatment, improve outcomes, and advocate and provide education to our patients. So is the PMHNP path right for you? So again, if you're drawn to like science and psychology, if you love helping people in through some of the hardest times in their lives, if you've had, things that have happened in your life, and again, you don't want other people to feel like that, this is the career possibly for you. So again, if you care about people, you love science, you want flexibility, because again, as you've seen, there's so many different settings, and you want to make a difference, this is definitely the career path for you. And I can honestly tell you, I absolutely love my job. I love working with patients, and I absolutely have enjoyed every different career path in nursing. And so as far as my day goes, like I come to work here at 6 o'clock in the morning. I look at my patient list, look to see what's going on in the evening. I get report. I go see all my patients on the unit. And then we, change treatment plan, decide discharge, all those different things. And I work with a psychiatrist every day. So this is really an amazing place. mental health units, patients are usually at the, feeling the worst they have been in their life. And we're making a significant change in a very short period of time. And so it's a really amazing thing to see. So anyway, anybody have any questions for me?
Awesome. Thank you so much for sharing all of your knowledge and all of those insights.